looked at people with autism, ADHD and hypermobility, and we found that you were 4 times more likely to be hypermobile if you were in the neurodivergent group than if you were in the comparison group.
Dr. Jessica Eccles
is a hypermobility expert specializing in its hidden link to ADHD.
Oxford and Cambridge graduate in medicine.
She's now on the forefront of cutting-edge research,
proving the connection between ADHD and hypermobility.
Hypermobility is a term used to describe having joints that have an unusual range of motion.
What's a way, a test they could do that might indicate that they have hypermobility?
Can you now, or have you ever been able to put your hands flat on the floor without bending your knees? Could you ever bend your thumb back to touch your wrist? Did you ever amuse your friends by contorting your body into strange shapes? Did your shoulder or kneecap dislocate on more than one occasion? And then finally, do you consider yourself double jointed? If you score 2 or more, there is a very strong possibility that you are hypermobile.
Does everyone with ADHD have hypermobility?
Well, that is really interesting. So,
really? This episode is dedicated to anyone who can bend their thumb back so it's touching their arm and really wants to understand why. Dr. Jessica Eccles, what a pleasure to have you in the studio.
Thank you, Alex. It's a real pleasure to be here.
I suppose quite a direct question to start, and that is, why should someone stick around for the next hour? In other words, what do you think you can teach them?
Hopefully a few things. I think there is a myth and a stereotype that ADHD is a brain condition, that it is a neurotype. Some people even talk about neurotypes, that it is to do with attention and hyperfocus. And that is all true. And we've come so far in busting some ADHD myths, about women and non-stereotypical presentations. But what I would like viewers and listeners to really understand is that ADHD is an entire body condition, that it is an embodied experience that isn't just in the mind. And one of the things is social media often says, oh, you can't tell that I'm autistic, or that you can't tell that I have ADHD. But the same social media is full of the ADHD walk. And so I am going to hopefully be able to talk to you a bit about why that might be.
Your specialist area is hypermobility.
Yes.
And it's a word that I've heard, a phrase that I've heard a lot recently. But could you explain, what exactly is hypermobility, and how does that differ from standard mobility?
Well, hypermobility is a term used to describe having joints that have an unusual range of motion. And we can kind of probably talk a little bit more about that in a bit. But essentially it's at the end of the spectrum of how far joints can move. And hypermobility is a bit of a clunky term. It doesn't roll off the tongue, and it's actually, I consider it to be a massive red herring. So it is hypermobile people have flexible joints, but what they actually have is a difference in how their body is built. So something called the connective tissue, which is like a cling film wrapping around muscles and organs and joints, is different. It's sort of stretchier than other people's. And because this is often things like collagen, because this is different, this explains a number of physical and mental health challenges and strengths that hypermobile neurodivergent people have.
So interesting. And if we were to sort of focus on the consequential strengths and challenges, what might some of those strengths look like? Well,
so hypermobility is associated with kind of exceptional performance in certain things. So there are piano pieces and guitar pieces that only people with hypermobile fingers can play. Most gymnasts, ballet dancers, and athletes are in fact hypermobile. And good examples of that is Simone Biles, who is in an absolute class of her own in terms of her Olympic power. However, if you are hypermobile, or Simone Biles also has ADHD, of course. If you are hypermobile, your joints move in ways that perhaps they shouldn't. You might have weaker core stability. You're more prone to injury. You're more prone to joints coming out of socket. And you're prone to a large number of medical problems like gastro issues. So if we're thinking back to this cling film, if that's lining the gut, you can see that it could make the gut move faster and slower and be stretchier or stiffer than it should be. But if you put a camera down there, you aren't going to see that in the same way. So lots and lots of hypermobile people have medical issues like gastro issues, asthma, sensitivities, allergies, and then this real interest in this activation of the flight or fight nervous system that called dysautonomia, this thing called postural tachycardia syndrome, where people's heart rate goes up when they stand up or eat a large meal or have a hot shower. I mean, some people have the experience that they have to lie down after they have a bath. And that is probably because if you have this floppy connective tissue, the cling film is stretchy. It means that you can't get blood back to the heart as easily. And so in order to keep your brain functioning and your heart pumping, you have to raise your heart rate. And this causes this whole activation of the involuntary nervous system, the fight and flight response, and that can look like anxiety. And some people get diagnosed with anxiety. And I think the work that we've been doing shows that it's all connected, hypermobility, anxiety, and this particularly sensitive nervous system, which may be in part due to the way the body is built.
So interesting. I was doing the research for this episode and completely ignorant when I started, and I just thought hypermobility meant, well, that means you got bendy wrists. That was where my base level started, but clearly there's so much more to it.
No, yeah, exactly. So there's lots of physical health problems, and there are also some mental health problems, and I think this is often underappreciated, but it means particularly physical health problems in young people may well be to do with hypermobility. So I am hypermobile, which I discovered at medical school when I was doing orthopedics, and a doctor came up to me and said, "You have sway back knees." So sway back knees are sort of where your knees seem to bend backwards. And he said, come and see me in clinic. And I did. And I was in a lot of pain because I had, at the time, early onset arthritis from a condition called developmental dysplasia of the hip. People won't have necessarily heard of that, but people know that when babies are born, there is this hip checking test. And that's what the developmental dysplasia of the hip is, and clicky hips is associated with it. And turns out that most people with developmental dysplasia of the hip have hypermobility.
So if people are listening and they're relating to some of this, or they're just discovering about hypermobility today, what's a test they could do that might indicate that they have hypermobility?
Well, there is a self-report questionnaire which you could do yourself, and there are also physical examinations which might give you some clues to ask a doctor to complete. So the self-report questions are, I might not have got them in the right order, can you now, or have you ever been able to put your hands flat on the floor without bending your knees. Can you now or could you ever bend your thumb back to touch your wrist? And also the other thing is a soft sign of hypermobility is having flat feet when you stand up. So you might not have flat feet when you are sitting down, but when you stand, you'll notice that your arches fall. The other questions about hypermobility are, can you now or could you, did you ever amuse your friends by contorting your body into strange shapes, or could you do the splits? And then as a child or teenager, did your shoulder or kneecap dislocate on more than one occasion? And then finally, do you consider yourself double jointed? So of those 5 questions, the hands flat on the hands flat on the floor without bending your knees, thumb back on the wrist, dislocations, party tricks, and double jointed. If you score 2 or more, there is a very strong possibility that you are hypermobile. The interesting thing is that if you don't score 2 or more, it doesn't mean you're not. And if you went to a doctor or a physio, they would do an examination. So they would look to see if you could bend your little finger back 90 degrees. They would look to see if you're on both sides. They'd look to see if your elbows, a bit like the knees that we were talking about, whether your elbows bent slightly backwards. They would also do the thumb on the wrist thing and the hands flat on the floor. But there are lots of other soft signs. So things like easy bruising, thin papery scarring. I don't know if listeners or viewers have any scarring, but scars that look like they're a bit scrunched up and thin, and also ankle sprains, tennis elbow, housemaid's knee, all of those things, varicose veins, hernias, sometimes I think that these signs don't really pick up men well. Men don't often seem to be able to do all of the finger maneuvers, but they often have particularly long, thin fingers, which are associated with hypermobility.
What's the difference? Why would a man not relate or be able to do the flexibility issues?
Well, there are lots of hormonal influences on the connective tissue. So we know that for your kind of hypermobile, neurodivergent women, because my thing is the link between hypermobility and neurodivergence, that both their mental and physical symptoms, so things like gastro issues, dizziness, lightheadedness, emotional regulation problems, allergy problems, they can all fluctuate according to the menstrual cycle. Typically worse just before a period. What we know about hypermobility is that hormones like progesterone, which is a female hormone, makes connective tissue more lax. So some pregnant women get this thing called pubic symphysis dysfunction. That's a feature of having a lot of progesterone. So it's possible that testosterone and lack of progesterone and estrogen have meant that some men appear stiffer in those joints.
Tying this all back to ADHD,
yes.
Does everyone with ADHD have hypermobility?
Well, that is really interesting. So hypermobility, and I've just talked about it as hypermobility, is actually defined in lots of different ways. And the diagnostic criteria for the different ways in which it's defined have changed quite a lot over the years. So there isn't consistency in the research in terms of the terminology. So, for example, we wrote this quite seminal paper where we looked at people with autism, ADHD and hypermobility. Autism, ADHD and Tourette syndrome. We compared them to a group without ADHD, autism or Tourette syndrome. and we looked to see if they had physical health problems, so problems with dizziness on standing and lightheadedness, and also pain, and whether they were hypermobile. And we used a particular definition of hypermobility, which was just limited to the joints. And we found that you were 4 times more likely to be hypermobile if you were in the neurodivergent group than if you were in the comparison group, and that you had more physical health symptoms, and that the relationship between neurodivergence and physical health problems to do with dizziness and pain was explained mathematically by hypermobility. But we used this particular definition, and using that particular definition, which was a score of 4 or more on this physical examination, we found that about 50% of the neurodivergent men scored 4 or more on that metric, and nearly 80% of the neurodivergent women scored 4 or more on that metric. But what we don't know is, had we used a different way of defining hypermobility, whether the figures would be different. So it is difficult, and people also talk, and listeners and viewers may be wondering, what is the difference between hypermobility and EDS, for example? So EDS is the Ehlers-Danlos syndromes, of which there are 13 or 14. Most of them are incredibly rare and have single genetic causes. Hypermobile EDS is not that rare, and there is no single genetic cause. So all people who have EDS have some form of hypermobility, but not all hypermobile people have Ehlers-Danlos syndrome, EDS. So if you looked at our paper and said, 50% of the men have got joint hypermobility, 50% of them wouldn't have EDS, but it is quite likely that they have hypermobility spectrum disorder, which has got an entirely different classification system. And I think this is the problem with recognizing and understanding hypermobility, is that the systems used to describe it and define it are just far too confusing. But in my clinical experience, so I work in a NHS service seeing adults with autism, ADHD and Tourette syndrome. I have very rarely seen anyone who doesn't have some form of symptomatic hypermobility, male or female.
So what causes the connection between the traits that would give someone a diagnosis of a neurodivergent condition and a diagnosis of hypermobility? What's the sort of commonalities there?
Well, there's 2 or 3 things that are going on. As I said, hypermobility, there's very rarely a single genetic cause. We know that in ADHD and autism, there's very rarely a single genetic cause. I mean, there's the odd genetic syndrome in which neurodivergence is a feature, and often hypermobility a feature too, so things like Fragile X. But we do know, though, that it really runs in families. So ADHD, autism, Tourette's, they run in families. Hypermobility runs in families. I think that they are basically inherited, and that the processes that are affecting the development of this cling film in the body, the connective tissue, are affecting the development of the nervous system, and that is why they go together, is because they are not necessarily genetically associated, but they are inherited together. But we have been doing some work, and this is under review at the moment, so this means it's being considered by a journal, that shows that if you have the more bodily, so not joint, bodily features of hypermobility you have, the higher your score on an ADHD screening questionnaire or on an autism screening questionnaire. And particularly when you dive in, and this was in a group of 110 people who all had hypermobility. And when you dive into it, there seems to be a really close relationship between hypermobility and the sensory system. So, for example, there's lots of collagen in the skin, important in touch. There's lots of collagen in the ear, important in sound. And I would hypothesize that the relationship between neurodivergence and hypermobility is not only genetic, but it is to do with the integrity, modulation and regulation of the sensory system. And we know, like, for instance, so we know ADHD and autism associated with hypermobility. Hypermobility is also associated with proprioceptive difficulties. So proprioception is a sense of where you are in space, which brings us back to the ADHD walk. That is a walk with difficulties with proprioception. And there are many, and this is one of the wonderful paradoxes about hypermobility and neurodivergence, is sort of the idea of ballet dancers who bump into doors. So you can have some amazing fine-tuned motor skills, but you can almost fall over yourself or spill coffee all over yourself constantly. And we know that ADHD, autism, joint hypermobility, they are all linked to dyspraxia, which is now called developmental coordination disorder. And we did years ago a study where we looked at hypermobile brains, and we compared them to brains that weren't hypermobile, and we found differences in a part of the brain responsible for fear, the amygdala. But we also found that the more hypermobile you were, the smaller a part of the brain about where you are in space is. And we put all of this together. So hypermobile people and neurodivergent people are known to have emotion regulation difficulties, a huge feature of ADHD. In fact, for adults with ADHD, most of them say that although the attention problems and differences are a big struggle, it's the emotional regulation difficulties, that idea of kind of going from 0 to 60 in seconds, of being up and down in the course of a day, the rejection sensitivity, this very overactive kind of rejection sensitivity, and everything being very intense. We know that neurodivergence is associated with these emotion problems. So we did a study where we looked to see, this was not in people with diagnoses particularly, whether their ADHD and autism characteristics predicted their emotional difficulties, which they did. This is in 200 people. It's published, and you can find it on my link tree, Bendy Brain. So there's this link between neurodivergent characteristics and emotion regulation problems. And that relationship is explained by a sense of uncertainty about where you are in space, which seems pretty wild. But then that relationship is twice as strong if you are hypermobile compared to if you're not hypermobile. So I am quite excited about this because it brings the brain and the body together, but it also suggests, and I mean, I know there are a lot of sort of gimmicks and people are trying to sell people things for ADHD all of the time, but we might be able to improve emotion regulation in neurodivergent people, not with drugs or brain stuff or psychotherapy, but by helping them improve where they think they are in space.
How do you do that?
Well, I think you would need like physiotherapists and occupational therapists who are far more expert in these matters than I. But it's a question, isn't it, of feedback and resistance and those kind of funny things that physiotherapists give you, the coloured bands. That would help you. I think what we need to do is design a program to do that. Oh, also the other thing is balance boards, those wobbly things. And core stability training, there's all sorts of things. But It sounds a bit strange, but there is this big thing in neuroscience about this idea of uncertainty. So our brains are, if I was to take on everything in this room in my head as it actually is, my brain would probably blow up. There's too much information to process. There's literally too much information to process. So my brain makes a shortcut whereby it predicts some of these things. It sort of samples some of them and fills in the dots. And that works quite well. But occasionally what you've predicted isn't what's actually there. And that difference, that mismatch, we call a prediction error. Now, you can have them, something like, going up the stairs. If there isn't a stair where you thought there was going to be a stair, you get a physical jolt. You kind of feel it in your body, but you also feel it in your brain. You feel it in your thoughts. And so what we think, and some of my colleagues at Brighton Sussex Medical School, Professor Hugo Critchley, have shown, and Professor Sarah Garfinkel at UCL, have shown that this mismatch, this uncertainty about what you are experiencing inside your body actually leads to anxiety. And I think a lot of neurodivergent experiences, and neurodivergent people are often sort of on the edges of experiences, are to do with this mismatch and imprecision and uncertainty. And tolerating uncertainty, as we all know, is really, really hard. And so if we can work through, so I was telling you about the postural tachycardia syndrome, where people feel weird when they stand up or eat a large meal. And this is often thought to be like a panic attack or anxiety. You can imagine if this is happening to you on a regular basis and you don't know why, you have no idea that it's because you stood up or because you just had a hot meal. You're thinking, am I going to die? Am I going to have a panic attack? What is going on? But if you have education about that, and we developed a type of therapy for that, an interoceptive training called ADAPT, and you basically reassured, actually, no, I am not going to have a panic attack or die. Nothing serious is happening to my body. My body is just really variable and reactive, and it's just doing its variable and reactive hypermobile neurodivergent thing. I think people feel much more at ease than having this sort of seemingly random thing. But it's not random if you know how to look for it, but you need someone to explain that to you.
Who's the most hypermobile person you've ever met? In other words, how far can the condition stretch?
Oh, well, yeah, and I was actually talking to a colleague last night, and she said hypermobility is not bendiness, it's stretchiness, which is a good one. I think I have been invited a couple of times to some really interesting events. So I have given talks to circus performers and also to aerial artists. Now, I don't really understand quite what the aerial artists are doing, but apparently it's quite big in musical shows, using silks and sort of balancing in the air. And it is, those are pretty extreme, particularly the circus performers. But it is so important to realise that you do not need to be a circus performer or to be able to do party tricks to be hypermobile. I have so many people say, oh, I'm not hypermobile. I'm the stiffest person I know. And then you test me, you're like, completely hypermobile, but they're, because they only know people who are more hypermobile, they have discounted it.
And I suppose following on from that, does hypermobility change as you age?
Well, this is a really interesting thing. So you know how years ago, people thought that you grew out of ADHD or that you grew out of autism.
Yes.
We know that joints do stiffen as a consequence of age. And I don't know if you remember, but there was once a Britney Spears album which had Britney Spears as an adult sitting in the W position. So, legs like this.
I don't remember, but I'll have to look that up afterwards.
So there is this idea of the W position, and some children sit in the W position, and it is a sort of a soft sign of hypermobility. My mother is going to be 76 in April, and I was speaking to her about the W position, and she insisted on getting, this is on the telephone, getting on the floor, getting into the W position, and getting my father to take a photograph. So and she could do that at 76, with nearly 76. So I don't think it necessarily declines with age, and I don't think that even if people have become slightly less stiff, so score less highly on a joint scoring questionnaire, that means that they have any less problems.
If you have ADHD, one thing that comes with it is the famous ADHD intuition. And my ADHD intuition tells me that you're all begging for that sought-after, sponsored ad read. Well, wait no longer. Here it is. Tiimo app is a perfectly tailored app designed specifically to help improve your organization. It's something I'm fast becoming dependent on to help get me through the day. If I want to remain organized and productive, that is, organizing a podcast, writing books, taking meetings, running errands, and looking after my cactus is so much to manage, you can end up getting overwhelmed and forgetting things. That is, if it weren't for Tiimo app. And this is how. Tiimo is designed specifically to hack the neurodivergent way of thinking. We have a brain that might struggle with time agnosia, object permanence, memory cognitive load, task initiation anxiety, or procrastination. All things I also fall victim to. Oh, perfect. It's reminded me it is cactus watering time. The award-winning Tiimo app is the perfect life-hacking tool to help your time management and kick you up the bum when you need it most. If you want to stay ahead of the competition, then the visual planning Tiimo app is specifically designed to help your structuring, organizing, focusing, and goal setting. It has a visual timer providing a tangible and visual representation of time to help users pace themselves so you never miss a deadline ever again. It also has an efficient lock screen reminder service to alert those of you who are very out of sight, out of mind with your chores and afraid you might forget them. It brilliantly centers all of your tasks in one place to streamline your overflowing schedules and make them much more digestible and a lot less intimidating. And for those who find big tasks too overwhelming to even start, Tiimo breaks them down into more manageable subtasks to get the ball rolling. Right. Now I need to go and change my trousers. Back to the episode. Someone like yourself, Dr. Jessica, who's clearly on the cutting edge of research into the world of hypermobility, what did the scientific community know 10 years ago on this topic compared to what it knows now? And what would you like to see new knowledge come out over the next 5 years, say?
Really interesting question, Alex. So I started researching hypermobility when I first came to Brighton Sussex Medical School in 2009. And 10 years ago, it was 2015, when I was in the middle of, almost end of my PhD. So at that time, when I was kind of thinking up ideas for my PhD and working with Hugo Critchley in that area, what we mainly knew about hypermobility was we knew about some of the physical health problems, and we knew a little bit about possible links with neurodivergence. Of course, we weren't calling it neurodivergence then. There was one or two case studies, well, maybe a few more, of children with what was then called Asperger's syndrome having Marfan syndrome or having lax joints. There was also a small literature, I think 2 studies about ADHD in children and them being more likely to be hypermobile. But it wasn't really until the late 2010s and the early 2020s that we really solidified our knowledge on ADHD, autism, and hypermobility. And also the work that we did, then further linking that to some of these physical issues. So when I started, the interest was all in anxiety, and we actually had another anxiety paper published a couple of weeks ago, and a few observant people on social media did say to me, "But don't you think that these people might have been autistic or ADHD? Don't you know hypermobility is associated with autism and ADHD?" And I had to write back and say, "Of course, you're absolutely right. But when I designed that study, we didn't really. And although we were interested in it, we didn't necessarily control for it or look for it. But what we did find in this study that we did then, that we just had published, this functional imaging study, we found that there was overactivity in a part of the brain that is to do with fear processing and emotion processing, the amygdala. This is a hypermobility and anxiety study. But we also found that the part of the brain that is responsible for regulating yourself, the frontal cortex, was underactive. And there was also some interesting differences in the insula. And what's fascinating is, although it's an entirely different study, different pictures that they're looking at in the brain scanner, this is classic what ADHD brain imaging looks like. So when they were doing the ADHD brain imaging that, showed that, were they really taking into account the role of hypermobility and anxiety? When we were doing this imaging, were we really taking into account things like ADHD? They might all be actually sort of the same or very similar. And this reminds me of something. So when I first started, there was quite a bit of interest in hypermobility and anxiety. There's a group in Spain that had been working pretty hard in that area, and they published a lot about hypermobility and anxiety. And I remember finding about 10 years ago, I can't remember the exact year it was published, but I think it was about 2013, 2014, a brilliant paper, some people would think it was comical, but about how hypermobility was associated with increased chocolate consumption, increased tobacco consumption, and increased alcohol consumption. And the I can't remember whether it was the chocolate consumption or the tobacco consumption. I think it was the chocolate consumption correlated with a fear sensitivity index. So these authors, quite rightly, at the time, said to themselves, are these, and I think this was more common in women, are these hypermobile, anxious people regulating their anxiety with chocolate, tobacco and alcohol? And that seemed plausible, and I'm sure it is plausible. But now, as a neurodevelopmental clinician, and obviously there's so many differences in terms of how we think about and understand ADHD and autism compared to 10 years ago. I mean, that's well, nearly 10 years ago, we didn't even, you couldn't be diagnosed with both. The DSM wouldn't allow it. It was only until DSM-5 in 2014 that was possible. But now I think to myself, that study, that amusing study, because I sometimes include it in slides, as, were these people actually regulating, were they trying to maintain attention? Were they regulating ADHD? Because so many people with ADHD use stimulants of all sorts, prescribed and unprescribed, often smoke, and we think of people sometimes regulating with sugar, especially once ADHD medicine is worn off, kind of midnight Haribo or what have you. And so it seems that actually could be telling the same story in different ways.
I laughed when you said sugar and chocolate because of the person that I referenced earlier with the inverted knees, similar to yourself, eats a lot of chocolate in the evenings, and they will be listening to this with great interest.
Yeah.
Where does pain come into all of this? When I was researching this episode, I read a study that said 75% of women suffer from chronic pain.
Who have ADHD?
Yes, yeah.
Yeah.
Is that correct? And is there a link between that and the hypermobility?
So in my clinical experience, almost all, because I am lucky enough to have founded with Hugo Critchley and Rebecca Dew at the Neurodivergent Brain Body Clinic in Sussex Partnership Trust, which is an NHS trust, where we look at patients' kind of physical and mental health concerns, ADHD, autism and Tourette's. Pain is such a common problem, hugely common problem. I mean, almost all of my patients are in some way pained and fatigued. And fatigue is another big thing. And actually, pain and fatigue often come together. So we did a study a few years ago where we looked at people with a diagnosis of fibromyalgia, which is a chronic pain condition, and people with a diagnosis of MECFS, a chronic fatigue syndrome. And we were trying to work out sort of biological mechanisms. You know, I talked about how if you, some people have this business where they feel dizzy and lightheaded when they stand. We wanted to see if pain and fatigue were in some ways related, particularly mental fatigue, related to those abnormalities in the involuntary nervous system. We also wanted to know whether they were related to problems with the inflammatory system. So we had this quite neat set of experiments, and so grateful to the participants who took part. And what we found was, of the patients who had fibromyalgia and MECFS, nearly exactly 4/5 of them met diagnostic criteria for symptomatic hypermobility. 4/5, but only 1/5 of them even knew they were hypermobile, let alone had a diagnosis. And so we've taken that work a bit further. We also found that the historical hypermobility predicted all the pain and fatigue levels and brain fog levels. And we found that we found a lot of differences in kind of inflammation, and so we found these differences in pain and fatigue were related to hypermobility and hypermobility's influence on the autonomic nervous system and on brain structure, brain function. We also found, interestingly, that the inflammatory reactivity in response to an inflammatory challenge in these patients was much more powerful in people who had long, thin fingers, which is a hypermobility feature. We then took this work a bit further in that I presented it at a long COVID conference, because MECFS and fibromyalgia are quite similar to long COVID, and formed a collaboration with Professor Claire Steeves, who had been setting up and using the Zoe app. Before it was a diet app, it was a COVID app. I think it was intended to be a diet app, and then COVID happened, and then all of that. But anyway, we formed a research collaboration, and we studied 3,000 people who had COVID, and we found that if you were hypermobile, you were 30% more likely to have not recovered from COVID. So I have long COVID. And I know we've also, myself and my colleague Lisa Quat, have replicated that in a different sample that's got less women and is more ethnically diverse. So we know that there is this relationship between hypermobility and long COVID. And it is really interesting to see how neurodivergence will fit into that. We don't have that data, but I would suspect that ADHD, autism are factors in long COVID, not just because of the effect on thinking and brain fog, but also because of having a hypermobile body and maybe being more sensitive to inflammation, more, the involuntary nervous system being more sensitive. And there's some initial studies that show some ADHD medicine, a slightly unusual one, so guanfacine, which reduces blood pressure, is actually a promising treatment for long COVID.
If someone's listening and they have hypermobility and they have ADHD and they are experiencing a lot of the negatives, how can someone like that help themselves?
Well, I think it's a tricky medical landscape. ADHD is not always well understood, and also, it's actually, it's people in the minority who've been diagnosed. There's many more people who are undiagnosed than are diagnosed, and the state of affairs with the waiting list is really terrible. So and also hypermobility, not everyone is aware of it. Not everyone's aware of its significance. Lots of people just think, oh, this is party tricks, or it's not medically important. I would say I'm a patron of a charity called SEDS Connective. I'm also a patron of a charity called ADHD Aware, that you look into the resources that these charities offer, and you try and have a conversation with your doctor. Now, there is actually so we talked about hypermobility in this condition called Ehlers-Danlos syndrome. There is something called the Ehlers-Danlos Society, and you don't need to have EDS, you need to be hypermobile to find it relevant. There is a GP toolkit that they have produced that helps doctors manage some of the common medical problems in hypermobility. I would say look at my Linktree, which is Linktree Bendy Brain, and just print out some of the papers and take them to your GP or your physiotherapist. But I think it's so important to realise that you are not alone, and that you are not, making it up, or that it's not just anxiety, that there are very many reasons why you might not be feeling your best.
Super useful. Thank you so much, Dr. Jessica. Just before we finish, I want to draw attention back to the table where your ADHD item has been patiently waiting for its reveal. Every week I ask my guests to tell me an item that most represents ADHD in their life or in their mind. And I'm going to reveal yours now.
Thank you.
Ooh, right.
Oh, wow.
I'm going to lift that up. Right, that is a book, a dance book.
Yes.
So why does a dance book or just dancing represent ADHD for you?
Well, it's an interesting one. So I have ADHD, I'm ADHD, and I can't dance. But we know that lots of hypermobile people can, or that really it's pretty much a prerequisite for dancing. And I think the closest I get to dancing is in relation to ADHD, in terms of, I've talked to you about lots of connections and things between things, and we've probably gone off on a couple of tangents. I think that's a type of dancing, but I really don't believe that in the ADHD superpower tragedy narrative. I think that it's got strengths and challenges, so it might be great to dance. And when I was young, I was quite fond of this film Flashdance, which came out, I can't remember, but when I was young. And in Flashdance, the main character is this sort of gritty, determined welder a female welder who wants to go to ballet school and dance. And so, and there's this song about kind of where the dancer becomes the dance. And there is an idea for me where putting all of these ideas together and then seeing them through in terms of maths, and it sounds quite boring to get excited about a computer screen that's spitting out statistics at you, but I really like playing with all of that. But it is sometimes you have to take a step back. And ballet dancers who are mainly hypermobile, they are giving you this fantastic, creative, wonderful display. And we're doing some research right now about creativity and hypermobility and neurodivergence, because there seems to be a lot of it about. I was inspired by a film director collaborator, Nigel Cole, about whether maybe there is lots of hypermobility and neurodiversity in the performance industry. But so you have this wonderful performance, and in some ways ADHD, you could look at me and say, oh, she's written all these papers and it's all wonderful. Those ballet dancers have probably lost most of their toenails. They will be in agony. And it highlights to me the strengths and the challenges, but that the world is better for ballet dancers, I'm sure. And as someone who has some of the physical problems associated with hypermobility, doesn't dance, this is my way of dancing.
That's really amazing. I've never thought of it like that before. I'm also terrible at dancing. Well, you didn't say terrible, but I am.
I mean, I physically, I've just, walked with the arthritis, but I am so clumsy. I would trip over my own toes.
Yeah, having mental dancing. I mean, it's such an amazing way to think of it. Once you get the orchestra in place, then the magic can happen, right?
And I think that's also one of the great things. I mean, there's lots of memes about this, but about kind of conversations between neurodivergent people, and people thinking, oh dear, ADHD people are constantly interrupting and butting in, or autistic people can't communicate. But there is a real neurodivergent on neurodivergent conversation style when it works well. That is its own form of dancing.
It can be quite frustrating if you've got that dance going on in your mind and you're talking to a slow talker, and the rhythm of their dance isn't quite at the pace of yours.
No, and that kind of sense of frustration when you know the answer but you can't say it, or you're also worried. You have this amazing thought, as tangent led to a brilliant thought, but then by the time you've waited to say it, it's gone.
It's gone. Yeah. I want to do the washing machine of woes, Jessica, which is the ADHD agony aunt section. And it's,
I think I became a psychiatrist because I sort of wanted to be an agony aunt. When I was younger, I loved reading magazines about real life stories and the agony aunt sections.
Well, this should be a perfect segment
for
you.
Well, it might be. I might not know the answer.
It's called the washing machine of woes, this section, because my ADHD item is a washing machine, because I always leave my laundry in the machine. And I ask everyone, do you relate to that?
Oh, God. Sometimes I've had to put washing on maybe 3 or 4 times to it's all, you get this the energy is there to bundle it into the washing machine, but somehow to take it out, very hard to find.
I have been using the Tiimo app though, Jessica, which is helping me get through this a little bit better.
Yes.
In the washing machine of woes, someone has written in and said, I suffer from chronic fatigue, which was always deemed as ME by doctors. A lot of people think I'm just lazy. Is there any chance this could be connected to my ADHD and hypermobility? And could I do something to test this?
I think that's a really interesting question. And I think that ME has, which is also called chronic fatigue syndrome, is woefully misunderstood. And we are veering a little bit closer, but I and colleagues, we've been trying to put together a funding proposal to trial an experimental drug called low-dose naltrexone, which is the low dose of a drug that was used in addiction, as a possible treatment for ME/CFS and fibromyalgia. We have not got very far. And I think we need so much more research and resources into ME/CFS. But in answer to the viewer's question, yes, wait a couple of months and you'll be able to read the paper. But to paraphrase, we found a link between neurodivergence and chronic pain and fatigue. That was explained by hypermobility. And that was in adults. We also had published, so you can find this on our Linktree, on my Linktree, a really interesting study. So people often say to you, is it correlation or causation, or correlation is not causation? How can you know what you know from this study? And this is a big problem with one-off time point studies. People are always saying to me, what does it mean that your hypermobile people have bigger amygdala? I'm like, I have no idea. We would have had to have studied them from the very beginning and see what happens. But there are a couple of times where you get to do that. And these are called birth cohorts. So in the ALSPAT birth cohort, which is all of the children born in Bristol and Avon in 1992, they were all, not all of them remained in the cohort, but a large number, I can't remember precisely, but maybe about 7,000 of them at the ages of 7 or 9, their parents filled out some screening tools for ADHD and autism. So that means we weren't relying on a diagnosis, because back in the 90s, how many people actually had a diagnosis? But we had that information on all of those 7 and 9-year-olds. And we then had information at 18 on whether they had chronic disabling fatigue, which is sort of precursor to ME. And lo and behold, if you had ADHD characteristics above a recognized threshold as a young child, twice as likely to have chronic disabling fatigue at 18. Same with autistic characteristics. But really, really interesting is, I've talked about these kind of mathematical explanations for why things are linked, was that the relationship between neurodivergence at 7 and 9 and chronic fatigue at 18 seemed to be explained by high levels of inflammation age 9 that were associated with autism and ADHD. So this is another example, a bit like the one I was talking about, the proprioceptive surprise and the emotion regulation, the neurodivergence and the hypermobility, of how the whole brain-body experience is connected. Because you can imagine how chronic fatigue syndrome is a bit like brain fog that you get in ADHD, that it could be a sort of all or nothing experience that you get in ADHD and autism. And I think that, but what we know is that if you think about what we said at the very beginning, or what I said at the very beginning about the embodied experience of ADHD, if we know that you are more likely to be in this stretchy body that is more sensitive to inflammation and autonomic variations, the involuntary nervous system, it all seems to make sense about how you can combine some of the thinking styles and the physical differences suddenly merge, perhaps because of a stressor like catching COVID or a transition at work, and then you are really struggling with fatigue. And I think it's also important, if you're in that position, to make sure that you're treating, that you're if you've got any dizziness or lightheadedness when you stand up, so POTS, symptoms that you get them managed. There's a really good POTS UK website for simple things you can do at home to boost that. We've got a brain imaging study at the moment that should hopefully show whether that autonomic challenge leads to changes of blood flow in the brain. So that's important. to do. It's also important, we don't talk enough about this in ADHD, but about energy accounting. I mean, that's partly because of ADHD is often being all or nothing and really struggling with the idea of pacing. But I think we only have finite resources. You don't want to get into burnout or burn up. You want to try and use the spoons that you have in a sensible way.
Burn up. What's that?
Burn up is where you become all fizzy. So burn out, you become, I mean, it's my own term, burn out or burn up. Burnout is where it's all got overwhelming, and you've almost become, not quite catatonic, but you're lacking any energy. Burn up is where you've got overstimulated and possibly overwhelmed, but you've basically got lots of energy. And I think they're the flip side of the same coin. And you asked me, what we might understand better in 5 years, and I forgot to answer. I think we will understand better in 5 years how ADHD and autism actually relate to the common diagnostic constructs in psychiatry that we already have. So what I'm just talking about is a potential explanation for mood disorder. And that is another problem. I think that people and some of my colleagues, and it's kind of understandable, they sort of think that ADHD or autism is something on the side. And that's why a lot of people struggle with person first language, because they don't like the idea of it being on the side. But I don't think you kind of, could, it's part of the whole experience, the physical and mental experience, what I said at the beginning. And it is central to that. So central to how you experience anxiety, to how you experience depression, or other mood problems. It isn't that you can just leave ADHD in a bag in this studio and it not be part of the very core of your being.
This has been truly fascinating, Jessica. Thank you for your time. I know how busy you are. There's one more thing that we do at the very end of this show, and that is to deliver you a letter that has been written by the previous guest, and they wrote down their 3 rules to live by.
Okay.
And they posted it in that post office. And through the magic of time travel, I'm going to deliver the letter to you now.
Thank you.
And if you could kindly read it out.
Okay. 3 rules to live by. Embrace your whole self, even the opposing sides. Well, I think that's wonderful, and that's a bit like the beauty and the torment of dancing.
Your whole stretch yourself.
Yeah, we're stretching. There was a book Isabel Knight wrote many years ago when I was first getting into researching hypermobility, a book about hypermobility called Bending Without Breaking. And if that could be, maybe this will go in my next rules, if you can learn to bend without breaking, I think that's so important for this whole hypermobile neurodivergent experience. Wake up to who you are and radically accept yourself. Be self-compassionate, but also your own fan. I think they're so important to embrace the whole of yourself, even the bits that you don't necessarily want other people to see or know about. And I was having a conversation with a friend the other day, and about how, and I think this is maybe more true for women, but I'm sure it can be true for men, that by growing up with ADHD, you sort of shave off all the hard edges of yourself to try and make yourself more acceptable to other people. Yes, it's people pleasing, and that actually learning to accept those difficult edges is really, really important. Self-compassion is easier said than done, but it is very, very important. Thank you, Alex.
Dr. Jessica Eccles, thank you so much. As I said, I came into this with very little understanding of what hypermobility actually meant, but now I feel like I'm walking away with a considerable understanding. So thank you so much.
No, thank you. It's really lovely to speak to everyone. And if you want to follow me, please look at my Linktree Bendy Brain.
I'll put all of those links in the description underneath this episode. Dr. Jessica, thank you so much.
Thank you.